Welcome back, dear viewers, with our first guest of the day. As you know, jaw surgery is more than a cosmetic procedure. It is a medical solution that can improve function, balance, and quality of life for many. In this regard, we are going to explore when jaw surgery is needed, who it is suitable for, and what patients should expect from diagnosis to recovery. So please join me to welcome Dr. Adel Alasfour, Assistant Professor in Oral and Maxillofacial Surgery, Acting Chairman, Department of Surgical Science, College of Dentistry in Kuwait University. Good morning, Dr. Adel.
Good morning.
So let's save time and shoot with the first question. To begin with, what is the corrective jaw surgery and why do a lot of patients now, they need it? Give us a brief, let's say, introduction about it.
Okay, thank you for having me. The corrective jaw surgery, or the other name for it is orthodontic jaw surgery. The ortho, it's a Greek name, a word for straight, correct, or upright.
Yes.
Meaning those who have imbalance in their facial proportion. When we see the patient from the side, you see the jaw is maybe or lower jaw or upper jaw, too forward or backward. Meaning there is discrepancy. So the corrective jaw surgery, orthodontic jaw surgery, is surgical correction to align the malpositioned jaw, either upper or lower jaw or both. And it is, as you mentioned, it's not actually a cosmetic surgery as much as it is a functional procedure or a surgery to correct function of the patient, because usually patient when they present with difficulty with chewing food, difficulty with pronunciation of some word or letters.
Yes.
Because they lack the lip seal, so the word or the letters like always have lisp.
The flow of the words and
yes, they have the air escape, so they don't. They might have some difficulty in pronouncing some words on letters.
And also it affects the way of swallowing and also
exactly
breathing.
Yeah, and also most important thing is sometimes it's improved breathing in cases like obstructive sleep apnea.
Yes.
So it's correct speech, bite, and breathing. The thing is, after you correct all these and you align the jaw in a proper position, facial proportion, it comes with harmony in their facial balance.
Yes.
So it also has a cosmetic or aesthetic in the facial appearance.
Yeah, so it has that, as you said, let's say, lovely effect on the face. It's just like it's gonna correct all the eyes position, the nose, and everything.
Yeah, because initially, when there is misalignment, there will be distraction. You will see the patient, there's something wrong, you're not sure because you're not doctor. But once you have all the facial skeletal in better or in the proper harmony or proposition, you will see the harmony on the facial effect.
Well, that's amazing. So, based on your experience, Dr. Adel, at what age it is suitable to perform that kind of procedures? We know that, let's say, there are a lot of elderly patients who wants to do jaw correction. Is it for cosmetic reasons or it's just for, let's say, they need it as medically, it's a medical intervention?
As yes, you just mentioned. But regarding the age, it's always recommended to have this procedure when the growth of facial skeleton has ceased. Growth stops, then we can proceed with surgery.
Yes.
This we are talking about straightforward skeletal discrepancy. There is no syndromic problems involved.
Yes.
So in the majority of patients, once the growth ceases, the range of 17 to 18 for females, 18 to 19 to 20 for males. And this is the time when we intervene surgically to correct the jaw relationship.
But is
surgically.
it too late?
No, it's actually the proper time. There is no limit for older age.
Yes.
As an older patient, he can do the surgery as 40 or up to 60. Like, because obstructive sleep apnea is diagnosed really late.
Yes.
People are in their 50s and 60s, they realize now they have obstructive sleep apnea. and they undergo surgical correction of their jaw position to improve their
sleeping.
Sleep, not the sleep, to save their life, because it can be fatal.
Exactly.
Okay.
But what I meant is that isn't too late for, let's say, children, younger patients, because sometimes they have, let's say, speech difficulties. And if late this, let's say, medical intervention, that means they're gonna need a lot of treatment, also speech therapy, to correct the way they used to talk.
Now, that's what I'm trying to say. We are dealing with a straightforward jaw misalignment, no syndrome involved.
Okay.
When I say it's improve the speech,
Yes.
The patient can speak, but you know there's some letters they have difficulty with,
Yes.
but not. I mean, they can have a comprehensive or apprehensive talk.
Yes.
You can understand them, but majority the bite, the breathing, the speech, okay, and the appearance at the end of the end result. But it's not late. But the problem is if you intervene surgically very early, there might be some relapse, because the body will continue to grow, and then you have a relapse. So it's important that we wait for the growth to cease. There is no further growth of the facial bones. Then we can do the surgery without any risk of relapse.
Well, that's amazing. If that answers my question. Now, my next question is, what is the common conditions that you as a doctor see in your clinic and necessary for medical intervention?
In terms of jaw corrective surgery, in our society, I think there are more of what we call it underbite. The lower jaw is overgrowth in relation to the upper jaw.
Yes.
So you have somebody with a prominent chin,
yes.
okay, or they have delayed growth of the upper jaw, so they have reverse bite. So these people usually have difficulty with biting, because there is the teeth, they don't align together to bite.
Yeah, they don't
so
synchronize.
They use that biting force. And see, the normal occlusion is called class 1. So we have class 1, then we have class 2, and we have class 3. In class 2, you have undergrowth of the lower jaw. So sometimes we have an open bite. So still, teeth are not coming together to grind the food. Okay, so people or patient, it depends mainly on the posterior teeth, which can be difficult and can cause jaw pain.
Yes.
The reverse is we have overgrowth or more growth of the lower jaw in relation to the upper jaw. So we have underbite. Again, patient can also
do like that.
Yes. So again, they don't have this grinding or biting ability. So they only chew the food at the back teeth.
Yes.
As all cancer can be also
painful,
very tiring to the muscle, and they cannot even enjoy food because they cannot bite in small pieces to swallow.
That's but also they will face difficulties in, let's say, raw and tough food, just like let's say nuts, eating nuts, or
they cannot eat even salad.
Oh, that's
so this is most of the patient after the surgery say, okay, thank you doctor, because now I can enjoy my salad, because they don't grind, they just chew. Yeah. So they don't see, I cannot bite my food properly. Apples, for example.
Yeah, apples are like, see, I once saw a report how to detect a jaw, let's say, as you know, that there is a problem with their jaws, by biting an apple. If the biting is difficult and painful, that means you have a problem with your jaw, that you need to go to a dentist.
Well, there's another cause of intervention to do the correct jaw surgery. Patient initially have what we call a temporomandibular joint problems, because there is a misalignment of the bony compartment, or disproportion between of the upper and lower jaw, and they do have some we call TMJ problem or disorders, and that we intervene surgically to correct their relationship, and this can improve their jaw pain and discomfort.
Is there any other kind of, let's say, non-surgical intervention or alternative? As you say, you intervene surgically, but do we have non-surgical solutions?
Okay, non-surgical solution is very limited to the very mild
conditions or
condition.
Yes.
We can also and usually we can intervene non-surgically by what we call it growth modification.
Yes.
But this is as early as 7 years of age or 8 years of age, and by appliances we call functional appliances. The problem is you cannot get the full cooperation of 7 years old or 8 years old, and usually this is very restricted to a small group of people for a mild dental problem.
Yes.
Remember, with the problem we have is it's a jaw problems, not teeth. The orthodontist, that's where we can intervene non-surgically, can only do little to align, do a lot to align teeth, but does little to align the jawbone.
Yes, they do braces just to align the teeth, but you intervene.
But if the problem with the jawbone,
that's another.
Yes, it is definitely a surgical intervention.
Well, okay. Now, based on the model that you brought to us, let's talk. This is like, let's say, the perfect jaw alignment.
Yes, this is what we call class 1 occlusion, meaning the upper jaw with the teeth is in front and behind, surround all the lower jaw teeth.
Okay.
So that's class 1. They come into occlusion. That's what we call it. When teeth bite together in a proper position, it's called a proper class 1 occlusion.
Okay, doctor, I have a question, personal question. A lot of my family members, especially my mother, they want me to do, let's say, a jaw surgery. You need to fix your jaw. You need to fix your jaw, or you need to cut your gums. Do I need that or not?
See, now we're talking about corrective jaw surgery. Was it functional, mainly functional, and then cosmetic. Now, when it comes to, there's also conditions that there's excess of growth of the upper jaw in a vertical dimension. So patient, we might have what's called, they show some gum when they smile.
Okay.
Okay, that's called a gummy smile. This is also can be treated non-surgically. Okay. But it depends on the patient. I would rather have patient come to me to correct his problem because, doctor, I'm not happy with my smile. I need something, if you can have something done to me. Yes, there is a condition. We can just reposition the upper jaw by taking a small piece of the bone, and then we correct the smile line.
Well, I won't go to through all that pain. I'm satisfied, alhamdulillah, with the way Allah created me, so I don't need any kind of medical or, let's say, surgical intervention to correct either my jaw.
See, having said that, sometimes the bony disproportion or abnormalities does not come singly, so it comes all together. Might have excess of upper jaw. Yes. We have a deficient lower jaw, and condition like an open bite. Yes. So patient cannot, the teeth, they don't really touch, and so the
there's a big gap between the upper and the lower.
And usually these people might have excess of the upper jaw, pushing the lower jaw backwards, so they have a small lower chin, a small lower jaw. Yes. Excess growth of the upper jaw and an open bite. So we can correct that surgically to reposition the upper jaw, bring the lower jaw forward, and have a nice seal, oral seal by the lips.
Okay. Now, before we end, let's talk about the recovery. A lot of patients say it is extremely painful. Tell me about the recovery journey.
Okay. Well, there's, the history behind this surgery has moved a lot. There's a big milestone for the development of surgery. In the past, this surgery takes a long time. Now, it's average 2 to 3 hours, maybe 4 hours. Yes. Okay. There is so much development in the surgical procedure. There's much development in the preparation for the procedure. Yes. Now it's all 3D guided. There's always custom-made plates and screws and custom-made surgical guide for procedure. That shortened the procedure a lot. Yes. Makes it to 1 hour, maybe 2 hours. So the shorter the procedure, the less complication of the procedure. When we talk about the complication or what's expected, of course, pain is always there.
Always there.
For first week, I always tell the patient, in the hospital, of course, take 2 or 3 hours. The patient usually pain-free. He gets home after 1 day to 3 days. First 2 to 3 weeks is the hardest for the patient.
Headache.
Pain, stiffness, cannot open their mouth. They're on soft diet or liquid diet. Then 6 to 8 weeks, almost full recovery. usually patient goes to work
Yes.
on the 3rd week.
Yes.
But so it's, I mean, it's not so painful as because you already correct and put everything back together. But
Yes.
once they start functioning, you might have a problem.
Yes, well, Dr.
Okay.
Adel Alasfour, thank you very much for joining us in Good Morning Kuwait. And we know that your field is extremely, let's say, difficult, but we wish you all the best in your future endeavors.
Thank you very much, and I hope all the information that we just talked about has been helpful to our reviewers.
They are extremely helpful. So, my dear viewers, thanks to our dear guest, first guest, Dr. Adel Alasfour, Associate Professor in Oral and Maxillofacial Surgery, Acting Chairman, Department of Surgical Sciences, College of Dentistry in Kuwait University. With that, we're going to take the first break after the interview, and then we're going to continue. So stay tuned.